So we just got 2 more minutes now before we get started at 6 o'clock, isn't it? 6 o'clock China time and 11 o'clock New Zealand.
So we need to wait a little bit. We need to get some people on.
Yeah.
I'm just on WeChat. I've got a couple of messages of people saying they're having trouble joining.
Oh no.
Again. We'll wait.
Yeah. Oh, there we go. Ali's just shared the link.
Oh, great.
The notes that Robbie sent through last night on how to actually join and log in and everything were actually really quite good. There's only just one thing that maybe I should actually just put in, was that if you try, well, I'm not sure whether it's the case for everybody, but certainly for me, if you tried to log in using mobile phone number, it doesn't accept that. So it just sits there and doesn't do anything. But if you put your email address, then it will actually.
Does work. Okay.
Yeah.
Thank you for that.
Yeah.
We'll modify that so that hopefully it works.
Yeah.
That's a good
Otherwise,
tip.
it's going to be fun. Yeah.
Yeah, that's great. Oh, there we are. Who's that? Who's arrived? Someone.
Being on time is a little bit relative in China, isn't it? It's a hard time, folks. It's still only 6 o'clock there, and I can imagine if it was me trying to make a webinar at 6 o'clock on a work day, it's tricky, isn't it?
It is. It is. Well, shall I start, Beck, and then people can join as they.
If you like, if you think we need to be being on time, or do we just give people another 5 and just see?
Yeah, sure. Yeah, let's see, because we're up to 9 already. Look, so Dr. Yin's here. We're getting there now.
Yeah, good. Okay,
yeah,
cool. Yeah, let's get started.
Yeah. Sure.
Yeah, let's.
So welcome everybody. I can see people are joining, and if I do the introduction, hopefully by the time we get to the main lecture tonight, everybody will be here. So welcome to our 7th webinar for veterinary education from ACTAsia and our partner Vets for Compassion, who together are the WSAVA education partners for China. My name is Dawn Peacock. I'm the Director of Programs at ACTAsia, and co-hosting with me today is Dr. Rebecca Waite, or Beck as we know her from VFC. Today's title is Investigating and Treating the Canine Cough, and Beck will introduce our expert speaker for today in just a minute. So while you're just joining, please remember to choose your interpretation channel to English or Chinese using the interpretation button on the toolbar. We'll have the lecture for the first part of the webinar, and then we will have an opportunity for interaction through Q&A. So please put your questions throughout this webinar into the Q&A box so that we can have that discussion afterwards. We will have the QR code for the questionnaire to see what you've learned today and to get some feedback that will help us with our future webinars. And we'll give you a little update about what we're planning in December and 2021 at the end of this webinar as well. So I'll hand over to you, Beck, and try to move this slide over. There we go.
Lovely. So thanks so much, and thanks everybody for joining us again today for the last of this year's webinars. It's been a great year, and we'll be carrying on again from February next year, after we have a little bit of a break over what is our summer on this side of the world. So it's my pleasure to introduce Dr. Richard Lucy tonight. I've worked in some capacity with Richard for quite a few years now. We haven't worked in the same practice, but on shared working on quite a few cases together. Richard's a Massey University in New Zealand graduate, 1992. He spent some time there as an assistant lecturer in anaesthesia and intensive care after he graduated. Then went on to be a senior medical registrar at Sydney University from 2001, and also spent time at the Royal Veterinary College in London in 2001 doing a cardiology and diagnostic imaging sabbatical. Been back in New Zealand for quite a while now in private practice, and as well spent some time as a volunteer vet in primate rehabilitation in West Africa. So pretty exciting career with lots of travel in there. Over that time, he's managed to collect a few letters after his name. He's a member of the Australian New Zealand College in Radiology and a Royal College certificate holder in veterinary cardiology, as well as going over to the dark side for a few days there, Richard, and retraining human echocardiography, working at our local big public hospital in the cardiology department for 3 years there doing echocardiography. So currently Richard is Director of Veterinary Diagnostic Imaging Services in Christchurch in New Zealand, and works purely on imaging, ultrasonography, radiography and CT. So tonight he's going to be talking to us about differentiating causes of canine cough and going a little bit into treatment of that too. I certainly know that particularly as a surgeon, a coughing dog can be a little bit of a daunting presentation sometimes. So looking forward to hearing what you've got to teach us tonight, Richard. I'll hand over to you.
Lovely.
Thanks very much, Bex.
I'll stop sharing. That should work.
Okay. Yeah, so I just want to get this back down to, okay, so I need to actually be able to see my slides though. So
we told you there was a trick to this.
I know, exactly.
Yeah.
Hang on, I need to get this. So
while you get that sorted, Richard, I'll just remind everybody, if you've got any questions as you go along, please type them into the chat window, and at the end of the talk we'll go through any of those. Please don't be nervous about asking questions. In general, if you don't understand something, it's very likely that there'll be some other members of the group who don't either. So the more questions you ask, the more we can get out of Richard's brain while he's talking, and we'll get to those at the end of the talk. Equally, if you've got any technical problems, if something's not working or you can't see slides or something, then pop that into the chat. You all right, Richard?
Yep, I am. I'm back on, so thank you very much. So
going on.
Right. Yep. So can you hear me all right?
Yeah,
I can hear you. I can't see your slides yet though.
Oh, you can't. Okay.
So if you hit the share.
Hang on.
At the bottom of the toolbar.
Okay. My toolbar has just. Oh no. Okay. Hang on.
I'm back.
No, I seem to have dropped out my toolbar. So I can.
If you slide your mouse right to the bottom, it might just pop out.
Yeah. Nope. It's disappeared. Hang on. Okay, so hang on right now. So okay, I've got my toolbar back, and I want the share one. According to this, okay. So
Does it give you the, there we go.
Is that working now? We're back on now?
Yes.
Yay, you've done it.
Perfect.
Cool.
Well done.
Okay,
Off
good.
we go.
All right.
Great.
Very good. Okay. Sorry about the technical hitch, everybody. So I thought I'd start today just by discussing a common condition, especially common in small breed dogs, from which I understand there are large numbers of as pets in China, and especially poodle breed dogs. And so that is, of course, the cough. So I thought that I'd discuss how we could go about investigating and treating a canine cough. So first of all, we'll just start by doing the boring stuff and defining what a cough is. So cough is a sudden expiratory effort which expels air from the lungs in response to a mechanical or chemical irritation. So some examples of that might be pressure, so for instance from a collar or from other pressure around the throat or around the neck, foreign material if the dog had inhaled something, secretions of course produced by the airways, or from other materials such as gas or smoke or other irritants. The cough is initiated by a number of different receptors, and there are distinct anatomical differences in the cough reflex. So in the upper airway, in the larynx and in the trachea, they're extremely sensitive to mechanical stimulus, and you can understand that or relate that from what you know yourselves, in that if when you're intubating an animal, the larynx is extremely sensitive to the pressure of the ET tube when you're actually putting that down. Or another good example of that is if you're drinking something and a little bit of it goes down the wrong way, or if you're eating something and it goes down the wrong way, you know that causes, you know, a significant, very strong cough or even laryngospasm. The upper airway is less sensitive to chemical stimulus. The distal airways, however, are different. So now we're talking about the bronchi and the bronchioles, so down in the actual lungs. They are very sensitive to chemical stimulus. So dusts, smoke, gases will induce a very strong cough response, but they are less sensitive to mechanical stimulus. And that is an important thing to remember in the case of inhaled foreign bodies. So if you have an inhaled foreign body which is stuck high in the respiratory system, so around the larynx or trachea, that's likely to induce a strong cough. But if you had, say, for instance, a grass seed which had been aspirated all the way down into the deep airways, or some liquid, paraffin oil, anything like that, that's not likely to induce a very strong cough response. Okay, and of course the alveoli, they have no receptors really at all. So cough really occurs in an alveolar level when they either have flooding with fluid, which we'll discuss later on, or if there's infiltration, cellular infiltration of the alveoli. Now, the most important thing in determining cause of cough, whether it's likely to be respiratory or whether it's likely to be cardiac, is taking a good history. So if you take a good history and do a good clinical examination on a dog who is coughing, you are going to get at least halfway to a diagnosis. just from a history and from your clinical examination, and it's really going to help you to narrow down your possibilities without having to do a lot of very complicated tests. Okay, so the most important things to take into account in your history are the age and breed of the dog. And as we said earlier on, certain breeds of dog are absolutely prone to certain conditions. And for instance, as we said, the small toy breed dogs, poodles, poodle crosses, they're very, very prone to dynamic airway disease and to collapsing trachea, and they will cough just as they age. So your age and breed are very, very important. The chronicity of the cough is also very important. So it's very important that you directly ask the owner of the dog, how long has this cough been going on? And a chronic cough is typically a cough that has been going on for 3 months or more. Okay, so a significant period of time. Also, it's important that you ask whether the cough is a wet cough, whether it's dry cough, whether it's productive or not. And so if you're wondering how you tell whether it's productive or not, ask the owners whether the dog, after it coughs, whether it swallows or even if it coughs something out. Ask whether the cough is a harsh cough or a soft cough, a honking cough. If you can, get the owners to actually video the cough, because that's extremely valuable for you to actually see the actual cough. Ask them as to whether there's a particular time of the day that the cough occurs. Does it occur mostly in the morning when the dog has just woken up and first starts to move around? That would suggest to you that it's associated with buildup of mucus in the lower airways whilst the dog is asleep. And then as the dog awakes and starts to move around, that mucus is then starting to be cleared by the mucociliary apparatus in the lower airways. The mucus is then shifted out and the dog starts to cough. Or does it just cough right the way throughout the day? Also ask them if it's associated with any specific activity. Does drinking or eating precipitate a cough? Because that's a very good clue if the dog has laryngeal paralysis. So a large breed dog, say for instance Labradors or golden retrievers, or mixed breed dogs, an older dog who has very harsh upper respiratory tract sounds, and when they drink or when they eat, they often cough associated with a small amount of material, so the water or the food becoming lodged around the larynx, and that of course stimulates a cough. So very important to ask whether there are associations with certain activities with the cough. Of course, is the cough caused when the dog's running or when it's pulling on its leash? And of course, it's important that you check to see if you can elicit the cough by palpating gently around the larynx and trachea. Also ask if the dog has perhaps been in contact with large numbers of other dogs. Has it been recently in kennels or in puppy preschool or in any place, dog parks or anything where there might be other large numbers of dogs? So getting a very full and thorough history is extremely important. So now our next thing is our list of differentials. And here we are trying to determine whether we have a cardiogenic cough, so a cough of heart origin, or a respiratory cough, because this is the essential thing for us to determine whether the dog is coughing due to heart disease or whether it's coughing due to lung disease. And there'll be very different presentations between the two. So typically, dogs who have heart disease are depressed, so they're lethargic. They typically also have a decreased appetite. They may lose weight. And especially if you feel along the lumbar muscles, along their back, they may be quite thin along there. So what's called cardiac cachexia. It is often acute and it's always progressive. Heart disease is progressive. Once a dog starts to suffer from heart disease that's severe enough to cause a cough, they get worse. Okay, so typically they also cough while they're resting. The cough is typically soft, and it's usually also associated with tachypnea and dyspnea. So the dogs are breathing rapidly, and they often have increased effort in their breathing, so increased abdominal effort. Now, if you compare that to a respiratory cough, these dogs are typically bright and active and have a normal attitude and a normal appetite. So the classic small breed terrier or poodle, which is bright and happy and bouncy and is very active. They're often obese as well. They're often fat because obesity plays a significant role in respiratory cough. As we said, typically a chronic cough, so greater than a month, but often in many months, 3 or more months. Typically the cough is associated with activity, or as I said, when they first wake up, because that mucus that's building up in the lower airways is being shifted as they start moving. The cough is often what we call paroxysmal, which means that it comes in fits of coughing, and it's often a very harsh, hacking cough. And there may be almost a honking type sound as well too. It's almost always elicitable. So when you squeeze gently around the trachea or around the larynx, then that will elicit the cough. Often when the owners bring the dog into the practice and it may be straining on the leash, then you will actually hear the cough induced at that time. Usually when they're not coughing, typically breathing is normal between the episodes of cough. So our physical exam, as we said, we need to examine the dog's demeanor and its physical condition, its respiratory rate and effort. And so one of the first things that I always do when I first examine an animal is, just whilst I'm standing there talking to the owner of the pet, I don't touch the dog, I don't pick it up, I don't do anything. All I do is just watch what it is doing as it walks around on the floor or as it's standing on the table. And so you're getting a good idea of what the dog's respiratory effort is and what its respiratory rate is, looking very closely to see whether or not this dog has a significant abdominal effort or not. It's also very important to do a thorough oral and nasal examination. So does the dog have nasal discharge? Is it unilateral? Is it bilateral? Is there blood or epistaxis? Also look at the very bottom part of underneath the nares, so what's called the nasal planum. Now, if you notice depigmentation in this area, especially if it's unilateral, or especially if it's on the side that there is a mucopurulent discharge, then that is a strong indicator to you that the dog may have nasal aspergillosis, so a fungal infection. And remember that any condition in the nasal chamber that results in a post-nasal drip, so in other words, that's mucus or blood or other material that drips over the back of the nasopharynx and then into the potentially down into the actual trachea or just into the nasopharyngeal region, will result in a cough. So just remember that a cough doesn't have to just be something in the lungs or larynx. It could also be in the nasal chamber as well. So it's important that you do a good oral and nasal examination. Look in the mouth, look at the hard palate, see whether or not there's a mass or anything there that you can see. Look at the tonsils, see if they're enlarged as well. Also, if there is a nasal discharge, take a cold glass slide and hold it in front of the dog's nose and look to see whether or not there is condensation on that slide as the dog breathes. That will tell you whether there is airflow through that nostril or not. So that will tell you whether or not that it's actually occluded or not. Also examine the neck as well too. Palpate the regional lymph nodes. As we said, also palpate the larynx and trachea. Be sure to auscultate or listen to not just the lungs and the heart, but also to listen to the larynx and the trachea as well. So when we compare the cardiogenic cough and the respiratory cough, a physical examination is typically quite different. A cardiogenic cough is typically associated with a significant heart murmur. So a heart murmur of 3 out of 6 or louder. So a 3 out of 6 heart murmur is one where the sound of the murmur is the same sound intensity as the heart sounds themselves. Okay. Typically, a dog with respiratory disease may or may not have a murmur, but it's usually a soft murmur, so only a 1 or 2 out of 6. Also, a dog with a cardiogenic cough, so a heart-based cough, will usually have soft crackles and bronchovesicular sounds. So crackles, the easiest way to describe a crackle is the sort of sound that it makes when you take hold of some hair beside your ear and rub it between your fingers, and that's the noise that a crackle makes. Typically, dogs who have respiratory disease as a cough will have crackles, and they often have wheezes as well. Now, dogs with cardiogenic disease, so heart disease, usually have tachycardia as well too. So their heart rate is elevated, and they may also have an irregular arrhythmia. Whereas dogs who have respiratory disease typically have a sinus arrhythmia. So heart rate that speeds up and slows down associated with breathing in and breathing out. Also too, of course, as we said before, typically a dog with a respiratory disease will often have an elicitable cough as well. So when you squeeze the trachea or the larynx. Now, our differential diagnoses for non-cardiogenic cough in small breed dogs, so in your classic poodle or similar small breed dog, the most common cause is allergic or inflammatory disease. So chronic bronchitis, chronic obstructive pulmonary disease, or dynamic airway disease. Now, also to pulmonary infiltrates with eosinophilia or an eosinophilic pneumonitis. Now, pulmonary infiltrates with eosinophilia and eosinophilic pneumonitis are inflammatory conditions. And if you did a blood test on these dogs, then you would see that they have a significant eosinophilia as well. Of course, infectious disease, so bacterial, so pneumonia, bacterial pneumonias, viral disease, fungal disease, protozoal disease, parasitic disease as well too, lungworm and the like. Now, but of course, remember though that as small breed dogs age, they do unfortunately commonly develop lung neoplasia as well, so lung cancer. Unfortunately, one of the most common forms of this is bronchogenic adenocarcinoma, and they usually solitary masses, but can be multiple. They unfortunately they carry a poor prognosis. We'll talk a little bit about further diagnosis of them soon. But as we also said, physical causes of cough, foreign bodies, tracheal collapse, laryngeal paralysis, postnasal drip, as we said, if they have a mass in their nasal chamber or an infection in their nasal chamber. But don't forget as well too that gastroesophageal reflux disease is also often associated with cough. And so if you're dealing with a brachycephalic breed, like a bulldog or a Boston Terrier or pug, anything like that, remember that if they have gastroesophageal reflux, and many of them do, that can also be associated with cough. And that needs specific treatment. Tracheal stenosis may also be a cause, or trauma as well. Now, but cardiogenic disease, of course, in small and large breed dogs is usually associated with pulmonary edema, so fluid in the lungs, and there's also a small degree of association with mainstem bronchus compression as the heart enlarges and elevates the trachea and may compress the mainstem bronchus. So, how do we go about diagnosing a cough? Now, as we said, the history and clinical examination are extremely important, and that's going to get us halfway to our diagnosis of is it heart associated or is it respiratory? But it's important that we also take some good quality thoracic radiographs and some blood work as well too. Now, extra tests that we might also consider doing, if they were necessary, might include a transtracheal wash or a bronchoalveolar lavage, or even pulmonary FNAs. Bronchoscopy, CAT scans, so CT, or fluoroscopy may also be used. And of course, if you have access to echocardiography, and you think that there may be cardiac disease, echocardiography is absolutely invaluable for diagnosing the cardiac condition. So what are we looking for when we take a radiograph? Now, of course, with cardiogenic cough, typically a dog with cardiogenic causes will have an enlarged heart. And of course, you can use the vertebral heart score to measure the heart. Dogs with respiratory cough may or may not have cardiomegaly. With cardiogenic cough, often you have compression of the mainstem bronchus as it's elevated by the enlarged heart. And when you look at the lung patterns, typically in the early stages, you'll have a mixed interstitial pattern, so a very fine network-like pattern with symmetrical, typically perihilar or caudal dorsal lung field distribution. As they progress, we may progress to an alveolar pattern where we can no longer see the pulmonary vasculature. When we compare this, however, to respiratory causes of cough, some dogs with respiratory disease will have cardiomegaly, but not often as severe. They typically have a bronchial pattern whereby we can actually see the bronchi, so the lower airways. They often have a bronchointerstitial pattern as well too, so a mixture of bronchial and interstitial, or may have a nodular interstitial pattern. So here's a good example of a bronchointerstitial pulmonary pattern. So a right lateral radiograph, we have the cardiac silhouette here. The normal, very dark lung fields are almost completely covered by this fine network of increased interstitial pattern. We can still see the cranial lobar vessels in the lungs, and so that's telling us that it's not an alveolar pattern. Here's another example here where we have this fine network throughout the lungs. We can again see the cranial lobar vessels and the caudal lobar vessels, so we know that this is not an alveolar pattern. But we can also see some end-on bronchi here and here, these little donuts, and so this is a mixed pattern with some interstitial component, which is the fine network, but also too these, we can see the actual the bronchi here and the end-on ones here. So this is a bronchointerstitial pattern. Here's the same one just zoomed up. So we can see these little end-on bronchi here with the peribronchial cuffing, so the white circle, what's called a donut, and then the actual little tram lines out here from the longitudinal view. So that's a mixed bronchointerstitial lung pattern, and when you see a pattern like that, then you're immediately going to be thinking that this dog is most likely to have respiratory disease rather than cardiac disease. Now, how do we go about treating dogs with respiratory disease? First of all, the most important thing for you to ensure that owners understand that dogs with chronic cough typically have a chronic condition, and so we are not necessarily going to be able to cure their dog. So it's important that owners are aware of this so that their expectations are managed. So it's going to be management rather than cure. How are we going to go about managing them? Well, first of all, we need to address environmental factors. As we said, many of these dogs are significantly obese, and the first thing that you can tell the owner of a dog which is obese and has a chronic cough is that the dog's cough will not stop until the dog loses weight. And the reason why is because dogs who are significantly overweight have much greater increased intrathoracic negative pressure. So when they breathe in, they actually have to generate a much higher negative intrathoracic pressure to actually breathe in, and that's much harder when they are obese. And so then that's then translated down through the airways, and because many of these small dogs have a form of chondromalacia, or they have weakened lower airways, when they're having to generate higher negative intrathoracic pressures, that then causes collapse of the lower airways and exacerbates the cough. So it's most important that these dogs, if they're obese, that they lose weight. That can be easier said than done, of course. Of course, also, as much as possible, avoiding exposure to respiratory irritants. So if the owners are smokers, encouraging them not to smoke around the dog, or not smoking at all. If they have any other form, if they use aerosol sprays or any other forms of obvious respiratory irritants, then encourage them not to use those around the dog, because that will exacerbate the condition. Also too, using a chest harness rather than a collar is very important, especially for those dogs, that have tracheal collapse. A very useful and very effective cough suppressant is just codeine. And codeine, the dose is 1 to 4 milligrams per kilogram twice a day. And that works very, very well as a cough suppressant. Typically, we don't see sedation or constipation at that dose. Anti-inflammatory trial of prednisone, so just at 0.5 to maybe 1 milligram per kilogram once a day for 5 to 7 days, is also useful, just to see whether or not the dog responds. If they do respond to prednisone, rather than putting them on long-term oral prednisone, which is likely to again cause obesity, and may also cause some other side effects as well too, instead change them over to a Flexitide inhaler, so an human asthma inhaler. Flexitide is our generic, well, the generic name here. So the actual active ingredient is fluticasone, and use the high strength inhaler, so 250 micrograms per puff or per actuation, and use that twice daily. Use it with a pediatric, so a child's spacer chamber and mask as well too. And of course, if your blood work tells you that the dog has an infection, then you might look at some specific treatments, so appropriate antibiotics, or perhaps even using a nebulizer. So nebulizers, so over here on the left, so here's a dog, just using a pediatric spacer chamber and a mask. Are very well tolerated if you train the dogs to use them. And here's a dog in hospital, which is actually on a nebulizer. And if you want to treat a dog who has a bacterial pneumonia, especially brachycephalic breeds, nebulizing them is a very, very important way of actually treating them. And you can nebulize them with antibiotics and with saline. If an owner doesn't have a nebulizer at home, then you can just tell them to take the dog into the room when they're having a shower, and just have the dog on the floor. Don't turn the fan on to take the steam out, or open up the window, and just let the dog walk around on the floor and breathe the steam, because hydration of the lower airways is one of the best ways to improve mucociliary apparatus function, and so then the dog can clear all the debris and the mucus out of its lower airways, and improve lower airway health. So steam therapy is something which is very easily done, and certainly works really, really well. So moving on now to heart disease. Of course, there's many different causes of heart disease in dogs. So our most common one, of course, is just valvular heart disease, so chronic valvular disease. But in large breed dogs, cardiomyopathy is of course more common. Genetic conditions also make up a significant portion of our canine heart disease, but we also get some other less common causes of heart disease, like inflammatory or immune-mediated cardiac disease. Arrhythmia, chronic arrhythmia, will also result in cardiac failure, or in less common cases, cardiac neoplasia. So when we look at the breakdown, of course, the most common cause is chronic valvular disease, and then dilated cardiomyopathy. So, talking about dilated cardiomyopathy, the underlying cause is an idiopathic primary myocardial failure. So we don't know why it happens. It's typically associated with problems with mitochondria function or sarcoplasmic reticular function. It's in certain breeds, its prevalence can be very high. So in certain large or giant breed dogs, for instance, in Doberman Pincers, in Great Danes or Irish Wolfhounds, prevalence may be as high as 30%. In general, though, the prevalence, it may only be 1% across the whole general cardiac or canine population. Typically, worse affected males in the 4 to 10 year bracket. And of course, dilated cardiomyopathy is strongly associated with a genetic link. So as we said, certain breeds are greatly overrepresented amongst the large and giant breed dogs. Whereas when we compare that to mitral valve disease, and so here's a couple of examples of the sorts of change that we see on the mitral valve. So we see this, instead of the nice normal thin valves, we see these myxomatous thickenings of the valve, and that can actually progress to these very large myxomatous thickenings. And then of course we get the left atrial dilation here, and then we may even end up with structural failure. So here's a little chordae tendineae, one of the little supporting structures of the mitral valve, which has ruptured, and that of course is going to result in a flail, and then sometimes you may even get left atrial tears, as this particular dog has had here. There's a tear in the actual endothelium, and you can see clot there and changes in the endothelium. We don't know why this myxomatous degeneration occurs. The general prevalence across the entire canine population is only about 10%, but in certain breeds, like for instance in Cavalier King Charles Spaniels, it may be as high as 60% or even more. And again, of course, typically male dogs, as they age, are much more prone to this condition. So heart failure is basically the inability of the heart to meet tissue perfusion needs. Our most common presentation is, of course, backward failure or congestion, and that's usually associated with left-sided heart failure. And it then, of course, results in pulmonary edema, so fluid in the lungs, and that's when we see the cough. But remember that the early signs of left-sided failure are not as severe as cough. The very first signs that you will see will be increased resting respiratory rate and reduction in exercise tolerance. So it's really important that if you pick up a murmur, a significant murmur, that you tell the owners of the dog that they need to start checking the dog's resting respiratory rate. They don't have to check it every day, but checking it maybe once every 3 to 4 to 5, maybe 7 days, but just to do it regularly and check it when the dog is at rest. Ideally not in a hot room, just when it's cool, when it's asleep. And the magic number is 40 breaths per minute. So if the dog's resting respiratory rate is less than 40 breaths per minute, then it's okay. Once the dog's resting respiratory rate starts to elevate beyond 40 breaths per minute, that's telling you that there's increased interstitial fluid. So this dog is starting to go into early pulmonary edema. And this will happen long before a cough happens, all right? So make sure that you get your owners to monitoring that, because if you can intervene early, then the dog's prognosis is much better. Of course, if you have right-sided heart failure, then typically these dogs don't have pulmonary edema. They have ascites, so they'll have abdominal effusion, sometimes a pleural effusion. Occasionally, with cardiac disease, typically left-sided cardiac disease, you may also have forward failure, so they may have weakness or fainting or syncope. Now, these are the sorts of presentations that you'll see with left-sided failure. Often it's acute. So in the picture of the Doberman here, you can see this very anxious look on its face, and you can see this frothy, bloody discharge, and that's actually coming from its nose and out of its mouth. Now that's not the vet that it's just bitten, or its owner that it's bitten. That is fluid actually coming out of its lungs. So this is a dog that is at risk of dying very, very soon. Okay, so and these are typically ones which are very, very acute presentation. They're lethargic, they're exercise intolerant. As we said, they often have wasting. Their appetite is poor. They cough. They have tachypnea and dyspnea. On physical examination, as we said, they have tachycardia, and they often have cyanosis, so they'll be a little blue or a little purple. They usually have a significant heart murmur, so 3 out of 6 or greater. They usually also have some soft crackles or wheezes. And these are the dogs that we take some thoracic x-rays of, so radiographs, and do echocardiography. What might we find if we did an ECG? Well, often if they have severe failure, then you will see left ventricular origin VPCs or even VTAC. So here's VTAC here. Here, of course, we've got a little bit of normal sinus rhythm, and then this dog's going back into VTAC. Now, when you see this rhythm, this is a very unstable rhythm, and these dogs are at risk of dropping dead. So you need to be able to actually treat their cardiac disease quite aggressively. So with cardiac medication that we'll talk about soon, but we also need to treat them with an antiarrhythmic, and in this particular case you would use lidocaine. The other thing to remember, and this is also very important, if all you pick up is an arrhythmia like this, remember that ventricular tachycardia is not always just associated with heart disease. If you heard an arrhythmia and you did an ECG and you found that ECG, make sure that you also ultrasound this dog's abdomen, as ventricular tachycardias or ventricular arrhythmias are often associated with a splenic mass or a hepatic mass. So don't forget that, okay, that cardiac arrhythmia is a symptom and it's not just of cardiac cause. It may also be associated with abdominal pathology. When you see an ECG like this, and this is atrial fibrillation, so there are no P waves here, okay? And it's irregularly irregular. So when you look at the R to R intervals, here's a short one, here's a long one, here's a medium one, there's another shorter one. So when you listen to this dog, when you auscultate its heart will be irregularly irregular and often very fast. So it almost sounds like a pair of shoes that have been thrown into a tumble dryer. So it's just like boom, 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 boom. It's all over the place. And that's a very good clue that you're dealing with atrial fibrillation. And remember that 85% of dogs who have atrial fibrillation have dilated cardiomyopathy. So again, a really useful clue as to what's going on. So as we said, good quality x-rays are essential. You're going to assess the heart size, pulmonary vessel size, the lung pattern. And so how do we assess the heart size? Well, we measure the length of the heart, we measure the width of the heart, and then we take those two measurements and we look at them compared to the vertebral bodies from T2, and we add those two together and we get a vertebral heart score in this particular dog of 10.25, so basically 10 1/4 vertebral bodies, and so that's less than 10 1/2, which is our cutoff for normal, and so this dog's heart size is normal. Okay, so that would mean that our index of suspicion for this dog of having cardiac disease is much lower. But of course, when you see lungs like that, well, you're going to think that it's got lung disease anyway. So here's an example here of a dog with cardiac-based disease. So it's a Doberman, and so we've got a big left atrial bulge here because we can see the splitting of the mainstem bronchi. The actual pulmonary vessels are very prominent as well too. Then this caudal border of the heart is very, very straight. And then when we look at these lung fields, we have this very patchy interstitial pattern here, perihilar, but also too some down in the cranial lung lobes as well too. Okay, and here's another example here. This one much more severe. So again, we have cardiomegaly. We have a very straight and caudal border. We've got that elevation of the trachea. We've got these big fat pulmonary vessels here and here, and much more severe. So this is almost alveolar pattern here, because we're basically starting to lose the normal appearance of the pulmonary vessels here in the caudal lung fields. And so when you can't see the pulmonary vessels, you know that they're being obscured by fluid in the alveoli, and so then by definition that's an alveolar lung pattern, and that's a dog that has significant pulmonary edema. So same dog, DV view. Remember too that these dogs are often significantly impaired as far as their respiration goes. So be careful when you take x-rays of them. So you don't want to cause them undue stress or further compromise their breathing by restraining them to take radiographs. Often just a single lateral will suffice. Make sure that you supplement them with oxygen whilst you actually take the radiographs, and often giving them a little bit of opiate beforehand, so just a very low dose of morphine or methadone, so just like 0.1 milligrams per kilogram is actually enough just to take the edge off them. The other good thing that it also does is it causes splanchnic vasodilation, so it dilates the vessels in the spleen and in the liver, and it will actually pull some fluid out of their lungs into their abdomen, and so it just helps with the whole process of helping to reduce some of the pulmonary edema. So again, another example of cardiac disease. Note the big fat vessels here. and that patch infiltrates. So echocardiography. Now, echocardiography is, of course, perhaps may or may not be available to you, and it's of extreme value in differentiating cardiac cough versus respiratory cough. Now, but if it's not available to you, then another easy option is to do a furosemide trial. Okay, so furosemide or furosemide, and so you would give the dog somewhere typically around about 2 milligrams per kilogram of furosemide, either by injection or orally. Give it twice a day for 3 to 5 days, and then compare the radiographs that you take right at the start, and then at the end of the 3 to 5 days, take another radiograph and see whether or not the lung fields have cleared. If the lung fields have cleared, then you know by default that the furosemide's doing its job, and so it's most likely to be cardiac origin pulmonary edema. So then you continue treating it with appropriate cardiac medications. If the lung pattern doesn't change, then you know that it's less likely to be of cardiac disease origin, and then you treat it for something else. So typical pictures that we get with echo. So here we've got our 4-chamber view. So here's our left atrium, here's our mitral valve, here's a big dilated left ventricle. And then when we look at it in M mode, which is just telling us its ability to contract, we can see that it's got significant left ventricular volume overload, so dilation. There's actually some asynchronicity of movement here as well, and some thinning and very poor contraction. So this dog's systolic function is significantly reduced. Here's a 4-chamber apical view. Again, big dilated left atrium, big dilated blunted left ventricle, greatly volume overloaded. And here, of course, also some similar changes in the right atrium and right ventricle as well too. And a dog that's tachycardic and also has atrial fibrillation. So classic presentation of dilated cardiomyopathy. How do we treat these dogs? Well, diuretics are the cornerstone therapy in congestive heart failure. So diuretics are what are going to save this dog's life. Okay, so typically furosemide, and it's important that you tailor the dosage to the minimum effective dose. And so that's when, as we said, it's important that you get the owners to check the resting respiratory rate. And so if they either just write it down and keep a little diary, of course there's phone apps that you can get these days which will check the or provide you with a little diary so that you can actually monitor resting respiratory rate. So your dosages, of course, diuretics, so furosemide or furosemide, don't be scared of using furosemide, okay? The important thing is that you use an appropriate dose, and dosages can range from 1 right through up to 6 or even 8 milligrams per kilogram, and you can use it twice a day or even 3 times a day. Okay, now the thing to remember is don't use it once a day, because once a day is just a waste of time. All right. The original name for furosemide was Lasix, one of the first ones, and Lasix came from shortening of it lasts 6 hours, because that's what it lasts for in people. All right, so dogs not too dissimilar. All right, so use it at least twice a day. Modest dosages are typically in the region of 2 milligrams per kilogram twice a day. All right, so just keep adjusting your dose according to the dog's resting respiratory rate. Remember that cardiac disease is progressive disease. As the condition worsens, you will need to adjust the dosages. You can, of course, also use spironolactone. Remember that spironolactone takes time to work, so typically in the region of about 10 to 14 days. And you can also use other diuretics like hydrochlorothiazide. So ACE inhibitors, the classic ones, of course, enalapril and benazepril are also of value. They stop the renin-angiotensin system activation. But remember that these are weak drugs in their action, okay? They're worthwhile using them, but they are very, very weak in their actions, okay? So they do have value, but these are not drugs that are going to save the dog's life, okay? Drugs that are going to save the dog's life, as we said, diuretics, and also too, we'll talk about vetmin very soon. Things to also be a little bit careful about with an ACE inhibitor is that if you have a dog who's hypertensive or if they're hyperkalemic, be careful if they're azotemic as well too. Also to be careful if you're using Digoxin on them or if they're on non-steroidals. And remember too that eventually the body always finds a way around what we try to do to alter it. And even despite use of ACE inhibitors, you do get a phenomenon called aldosterone breakthrough, and you will get increased levels of aldosterone despite their use. So that's why ACE inhibitors are relatively weak in their use. So the important thing is they also do not slow the progression to failure when you used an asymptomatic animal. So don't use them until the animal actually starts showing clinical signs. There's no value in doing that. There are a couple of other sort of random drugs as well too that you can use. Digoxin, but be very careful with the dose because digoxin's toxic to therapeutic index can be close. So you need to reduce the dose if the dog is thin or if it has renal disease or if it's just generally unwell. Antiarrhythmics if they're indicated, as we said, so lidocaine in the cases of ventricular tachycardia, and you can also titrate in amlodipine to help to reduce blood pressure if a dog was hypertensive. Now, vetmin, though, has rapidly become a cornerstone as well of treatment of cardiac disease in dogs. And the two drugs, furosemide and vetmin, are really the two drugs that are going to save your patient's lives, prolong their life, and most importantly, improve their quality of life. Okay, so because as vets, of course, our most important thing is that we're concerned for our animals' welfare. And so by using appropriate medication, we can improve their quality of life, and so we're actually improving their welfare. Now, vetmedin or pimabendin is a combined ionotropic drug, so it increases cardiac systolic function and it also causes peripheral vasodilation. It works really quickly, so within an hour of being ingested, it's working. It also inhibits phosphodiesterase, which is a very, very important neurohumoral mediator in cardiac disease. And it also modulates cytokines, so it reduces the inflammatory cascade that occurs with cardiac disease, and it's the inflammatory cascade which results in things like cardiac cachexia and the general unwellness. So vetmedin is a very, very, very important drug. As we said, it reduces neurohormonal activation, and long-term use of it doesn't result in neurohormonal activation. So when we compare this to an ACE inhibitor, ACE inhibitors do cause that, whereas pimabendin or vetmedin doesn't. So Vetmedin is the most tested veterinary cardiac drug. There's been a number of massive trials, comparatively speaking, in veterinary medicine, in which all indicate greatly improved survival times and greatly improved clinical signs. So in other words, quality of life and longevity in dogs with dilated cardiomyopathy and mitral valve disease. So works in both conditions. So when do we use it? Well, it's indicated for use in early symptomatic mitral valve disease. It's also indicated for use in dilated cardiomyopathy. You can use it as a monotherapy or most typically in combination with other commonly used cardiac drugs. So as we said, furosemide. Pimobendan is also, as we said, indicated for use in DCM, and it will up to double your survival time in DCM patients. Don't use it, however, in subaortic stenosis patients or in hypertrophic cardiomyopathy patients. But hypertrophic cardiomyopathy is very rare in dogs anyway. So the other thing to remember as well too is that mixed disease, so respiratory and cardiac disease, is a very common occurrence. Okay, so as we said, you guys see a lot of little dogs, little poodles and the like. Poodles often have mixed disease, so they'll have dynamic airway disease and they'll have cardiac disease. And so then, of course, it's up to you to figure out what is the most important part which is causing cough, or are both things just as important, and you have to treat them both. And to be honest with you, that's actually very, very common. So often you need to treat the cardiac disease and you need to treat the underlying chronic respiratory disease. So again, as we said with chronic respiratory disease, it's more about management rather than cure. So, and here's a radiograph. Sorry about the quality of this one. It hasn't translated particularly well, but here's a dog which has dynamic airway disease, and it's also got some significant cardiac disease as well too. So it's got these big fat cranial lobar vessels. It's got some perihilar change here, big left atrium as well too. So that's a big left atrial bulge, and that's the classic sort of picture that you will see in the elderly poodle who has a mixture of cardiac disease and respiratory disease. And so these are dogs that you have to treat their cardiac disease with Vetmedin and diuretics, but then you also have to treat their respiratory disease as well too, often with some codeine or with fluticasone inhaler, as well as we said, all the management, environmental management regimes that you have. So that really concludes my talk for this evening. So thank you very much for you all for taking the time to actually tune in tonight. So I realise, of course, that it's probably a difficult time for everybody straight after work, but thanks for taking the time to join anyway. So thank you.
Thanks, Richard. Thank you. We have straight away got some questions for you. So I'll start at the top, Annie. Is that all right? I'll start with the English ones. So Dr. Richard, thank you so much for the webinar. Could you please explain a bit more why dogs with respiratory reasons will be associated with obesity?
Why dogs cough more when they're obese with respiratory? Yeah.
Okay. So now they're typically dogs who are overweight. They often will have a significant amount of intrapleural fat. So that, for starters, takes up room in the thorax. Plus also too, when they are really fat, they have to work harder to breathe in. So they actually have to work harder to generate that negative intrathoracic pressure. Now, when they have to work harder to do that, then typically dogs with chronic respiratory disease, they have weak lower airways, so they have a degree of chondromalacia. And so when they're working harder to generate that negative intrathoracic pressure, that means that you get much more collapse of those lower airways associated with that increased work of breathing. So that then results in increased or exacerbated dynamic airway disease. So, and then of course they then cough more. So that's why it's really, really important that those dogs who are obese, do lose weight, because if they don't lose weight, then the cough, of course, won't reduce. And of course, from a health and welfare point of view, it's important that they lose weight as well too, because that takes a lot of stress off their joints. They're likely to be more active and just enjoy life more.
That's great. Thank you for that. The next question is from Dr. Yin, and she wants to ask why the caudal border of the heart will be straightened on the radiographs.
Mm-hmm. Now, it's just basically associated with how when the left ventricle enlarges, especially in a dog who has a reasonably tall heart. So the ones that I showed you were actually from Dobermans, and so with dogs with tall hearts, when they get left ventricular enlargement, the heart, the way that the enlargement translates on a radiograph is that the left ventricle enlarges, the left atrium also enlarges, and so then you get that left atrial bulge, and then that becomes confluent with the left ventricle, and then you get that straight back border. It does depend a bit on the chest wall conformation. So as we said, those are in dogs that were deep-chested dogs. So if you had barrel-shaped dogs, chested dogs, like say for instance a Staffordshire Bull Terrier or a Bulldog or something like that, often their hearts will actually become more globular or rounded. So there are some breed variations. All right.
Lovely. And Annie, shall I go to Dr. Yu's question? Is that the same?
Yeah, it looks like.
Yeah, sure.
Translated
She's
that
translated it already. Lovely. So, I think my sound's gone a bit awry. Okay. So Dr. Yu has asked, in patients with severe MVD that the blood regurgitates into the chamber, can we use pimabendin to treat these cases?
Absolutely, yep. So for mitral valve disease, so dogs who have severe mitral valve disease, as they quite correctly say, it's associated with major mitral valve regurgitation. So the blood is going in a backward direction into the left atrium. Pimabendin is absolutely indicated for those patients. So pimabendin and furosemide are the two drugs that you reach for in those patients, because those two drugs are going to save that patient's life and increase its longevity, and, as we said, really importantly, increase its quality of life.
Lovely. Great. And that's all we've got so far. And we do have a few more minutes if anyone does have a burning question that they want to bring up. Wait and see if they flood in now.
It's a lot to cover in an
Yeah,
hour.
I know.
Yeah.
So many different solutions, couldn't you? Yeah. I think there are a few people now with access to good ultrasound machines in their practice, Richard. So hopefully some of them, I know some of our trainers will be able to do the basics of echocardiography, probably better than I can.
Maybe we should try and set up some sort of, I don't know whether we can set up some sort of, forum or something like that where, perhaps, I don't know whether we can do some sort of image transfer forum or something where they can post images or cine loops or something like that and actually get input from us. Is that something that would be feasible or doable? I don't know.
Yeah, I think it would be doable. At the moment, I'm kind of anything that we can do from a distance, and everybody is keen to learn. It's the resources aren't there locally. So yeah, I don't see any reason why we couldn't. It's Annie, are you there? Can you hear me?
Yes, I can hear you.
Yeah, I just wondered if you could ask how many of our group are using echocardiography or have an ultrasound machine that has that capability in their practice. Are there a number of people who have that facility?
OK， 就是老师想问一下，我们在听的这个培训师，大家自己的诊所或医院里面，有那个超声检查的仪器，或者说是有能力做心超的这样检查的培训师，请大家开下话筒回答一下，谢谢。
Everybody's muted. They could put it in the chat box.
Yeah. I wonder if WeChat will work for this, as the platform to be able to have this exchange.
It might.
I was imagining actually earlier when Richard said about the coughs of dogs and listening and getting the owners to video the dogs and send that in. I was imagining our WeChat feed full of little videos of different dogs coughing at different states and
yeah. That's definitely something that we could. I mean, there's the technologies there, and I think it would be easily doable. So, how do you need moving images, Richard, or can you manage with still?
No. Yeah, I mean, cine loop, moving images are always nice, but for cardiac disease, yes, stills is fine as well too. Yeah.
So I think that we probably could easily do that. Annie, can you translate for me the replies that are in the chat box?
Yes, so 3 people responded that they can do the echo, cardio echo, of 4.
Yeah, great.
Yeah.
Would you mind asking for me if anyone would be interested in having some assistance in interpreting their images?
Yeah. 就是大家培训师那个老师想再进一步问一下，那大家对于这个心超这个以后就是如果说想要做检查，大家需不需要有一些辅助的一些培训一类的 ？Yeah. Now already there's Dr. Zen. He answers he wants to have a training.
Yeah. So that's definitely something we can set up. At the moment, we have a group on what's called WeChat, Richard, which is it's pretty much like Chinese Facebook, sort of, but a big we talk and share pictures and information and what people are doing, and it's actually really good at file sharing. It can share some quite big files, so I think that we could definitely organise that, and it's a people with positive replies there. You're going to be in trouble now. You're going to get the whole of China. Yeah, lots of things there. Great.
That's really good.
Yeah.
Cool.
And many people answered that they need help and training on cardio and so there you go. You have to next year's webinar, Richard, now that we've got the technology working properly.
Yeah. Don't waste it now.
Right. Something to think about. All good.
Brilliant.
Anybody else got any other questions? I don't think so. There's been just so many people saying yes, we want more. Everyone wants more training about that. Yeah.
Brilliant.
We'll make it happen. So thank you so much, Richard. As usual, I learned as much as these guys probably. Thank you so much for your time. And if anybody does come up with any other questions that they've wanted to, they think later, I wish I'd asked that, just pop it into the week chat group and I can liaise with Richard and get an answer for you and reply. Dawn, you've popped the QR code up for the questionnaire.
Yes, please, if everybody could scan that and answer the questions really quickly. Feedback to check what you've learned, but also just to get some feedback and help us to plan for topics and things for next year. So yeah, please do that. And I think we just wanted to say a big thank you to all the vet trainers, everybody who's joined this webinar, but also the 6 previous ones. We think it's been a real success this year to launch this activity, and we do want to keep it going in 2021. So watch this space to find out what we're planning, what we've got in our minds for you for next year. But we will try and make a meeting for all of the vet trainers in December where we can go through our plans for 2021, along with myself, Beck, Pay and Elaine as well, so that we get to keep them in touch with you, because they've missed having that contact this year as well.
Definitely.
Yeah.
It's a shame we can't do it with good Chinese food though. Hey.
That's right. That's right. Oh,
lovely.
Okay.
Great.
So thanks everybody, and I'll go ahead to close the meeting. But yeah, thanks Richard. That was a brilliant way to end our year of webinars.
No problem.
Thank you.
Lovely. Thank you everybody. Good night.
Thanks everyone. Yeah.
Bye.
Bye.
Good night.
Bye.
Good night.
Thanks Annie. Thanks Belle. Amazing work as usual.
Thank you. Bye.
Bye. Bye. There we go.